So when do we need action? Of course, on every dairy farm there will be some heifers that freshen with an intramammary infection. But when do we speak of a heifer mastitis problem herd? Well, if more than 15% of the heifers have clinical mastitis around calving, or if more than 15% of the heifers have a first testate somatic cell count of more than 150,000 cells per ml, then we can say, yes, this herd has problems with heifer mastitis and then action is needed. It should definitely be investigated. Samples should be taken for bacteriological culturing so that we know which pathogens are causing the intramammary infections, and a real prevention and control program needs to be implemented. So nowadays there is a 10-point prevention and control program specifically focusing on heifer mastitis, and actually it includes the points that we have already discussed. So a hygienic environment is important. We need to have an effective fly control strategy. We need to avoid nutritional deficiencies, minimize the risk of negative energy balance, then reduce the incidence of udder edema. It's also important to reduce the risk of cross-suckling, so avoid group housing, or at least avoid giving and feeding milk from infected cows to the calves. Minimize stress around calving, improve general udder health, that will also reduce the spread and transfer of bacteria from adult cows to the heifers, and then consider an internal teat sealant, because we have seen that quite some heifers have already open quarters from 3 months before calving on. And then the last point I like to discuss with you is the use of prepartum antimicrobial treatment. Of course, it does not really fit in the strategy and policy on reducing antimicrobial usage on dairy farms. But in some cases, it might be recommended. The idea of prepartum treatment in dairy heifers is that we will eliminate bacteria that are present in the udder, that we will kill the bacteria, and so that we will reduce the risk of having an intramammary infection in early lactation. And by reducing intramammary infections, that we will have better udder health performances throughout first lactation. Still, at this moment, there is still debate about the impact of pre-calving treatment on the future performances of those heifers. We also have to take into account that we are talking about an off-label use of antibiotics. And, as I said before, it does not really fit in the policy of reducing antimicrobial usage on a dairy farm. So that means that if we will recommend it to a farmer, that it needs to be a conditional and temporary prepartum antibiotic treatment. That means that we will only do it and recommend it, and that it needs to be done under the supervision of a veterinarian. That taking that action and implementing pre-calving treatment should be done based on results of bacteriological culturing and antimicrobial sensitivity testing. So on those herds that only minor pathogens are isolated, it's definitely not recommended. In all cases, milk samples should be taken to test for residues before milk is delivered for human consumption. And of course, it's also very important to upgrade the management so that in the near future we can actually prevent those intramammary infections. A short wrap up. Heifers can freshen with intramammary infections. In fact, a high proportion of heifers freshen with intramammary infections. Some of them cause subclinical mastitis. Some of them will result in clinical symptoms or non-functional quarters. The majority of intramammary infections are caused by coagulase-negative staphylococci, especially those isolated from subclinical mastitis cases. And if we talk about the impact of those intramammary infections, then we see that it's quite limited. There's a slightly higher cell count, but there is actually no impact on the milk production. And contrastly, we even have higher milk production in coagulase-negative staphylococci infected heifers compared to the non-infected ones in some studies. Risk factors, it can be prevented, it can be controlled, Risk factors are related to reducing the infection pressure, increasing the immunity, and reducing the transfer of bacteria and reducing the spread of infection. So, thank you for your attention.